We asked our audience for their stories about getting help for a serious mental illness in New South Wales. This is what they told us.
My son was brave, compassionate, deeply sensitive and fiercely intelligent.
My daughter was kind, funny, and a great storyteller.
My brother Luke was an introvert, gentle and creative.
In the first half of 2024, our son was admitted 3 times to the emergency department. Then in July, experiencing distress and not wanting to go back to the emergency department, he called the acute care community team and asked for help. He was informed that there was no assistance available as they were understaffed.
Luke had self-presented at a mental health unit 3 times in 3 weeks. He also self-presented at a hospital emergency department with suicide ideation and a plan. This should have been a major alarm.
The day before her final discharge from the psych ward, she said to me, "I can't wait to get out of here so I can kill myself." I told the doctors exactly what she had said, but they discharged her the next day. My daughter Alice died by suicide on June 17 last year. She was 33 years old.
Our son died late last year, aged 19.
In March last year, my brother Luke took his own life.
He was a beautiful, clever, thoughtful, compassionate, perceptive, loved, loving and profoundly sensitive child and adolescent who had struggled with courage and resilience.
Alice was a cherished and much-loved daughter and sister. She studied, worked many jobs, most recently as a carer, and she travelled the world.
Luke was a person. He had a life. He deserved better.
I believe very strongly that Alice's suicide was due to a complete failure by the health system, a failure in duty of care. There were a sea of red flags that were ignored, overlooked or minimised. At times our concerns were met with a condescending attitude from staff.
After he died, a serious adverse investigation was held. The report was over 200 pages long, finding multiple systemic failures and lack of procedures that contributed to Luke ultimately taking his life. They were called missed opportunities.
I was later told by a member of this team that the understaffing and under-resourcing of this service is the worst it has been for 20 years, and the service is unable to help young people experiencing acute distress or crisis, such as my son.
At what point is government across all levels going to understand and recognise that we in Australia have an escalating mental health crisis that is not being adequately addressed?